Welcome back. When you think of Botox, images of smoothing fine lines might come to mind, but rarely do we think of dentistry. Turns out Botox plays a big role in helping you achieve the smile you've always wanted. Joining us now to explain is Dr. David Pousson with Pousson Family Dentistry. Welcome back to Great Day.
Good to be here, Jackie.
Glad to have you. So, starting out, what exactly is Botox?
Botox is a therapeutic, purified neurotoxin that blocks the transmission of impulses from the nerve to the muscle, so it kind of paralyzes the muscle and prevents it from being as strong or as effective as it normally would be.
And how does Botox play a role with dentistry?
Well, get back to the Botox. So any wrinkle that you have generated by a contracting muscle can be eliminated or decreased by using the Botox. So for dentistry, we have several different uses. One would be cosmetic, of course, if people want to just look their best and feel their best about that, would use that for a cosmetic application. But it's also therapeutic in that it'll help people who wake up with headaches every day. You can use it on those muscles that are contracting and clenching and becoming tired and overworked, and get people healthy again that way. I recently did somebody Monday afternoon who couldn't turn their head to the right because of their occupation. They always looked this way, and these muscles became just kind of contracted and couldn't move. So I used Botox on his back of his neck and his trap muscle, and as soon as I finished the therapy, he was able to turn his head and had no pain, and it was just amazing.
Wonderful.
Yeah.
And do you need multiple treatments?
Well, the Botox only lasts for 3 months, but the more you use it, the less you have to use and the longer the interval where you have to use it. So it does decrease over time.
Okay, so those are the benefits of Botox and dentistry, and then we did mention the neck. Are there any additional advantages of dental Botox you'd like to address?
Well, there's a lot of people out there who lead very stressful lives, that they get in the habit of clenching their teeth, and it can be devastating to their teeth and the gums and some bone and any dental work they might have. So I've recently used that to help somebody who has destroyed their teeth by clenching and grinding. We're in the process of reconstructing his teeth and mouth and chewing, and he's starting to break through his temporary crown. So we hit him with 110 units of Botox in his jaw clenching muscles, and he feels better, and his dentistry is working out just fine.
Wonderful. And people clench at night too, not just during the day, right?
Correct. And the significance of that is because if we put a sensor in your mouth and said, Jacqueline, bite as hard as you can, you could generate about 20 pounds per square inch. At night, when you're sleeping and you don't have that protective mechanism in effect, you can generate 800 pounds per square inch. So you can tear up some teeth and dentistry pretty easily.
Oh my goodness. Is that just because we're not cognizant of what we're doing, or?
You're not. You don't have that protective mechanism.
Right.
Right.
Okay. So why is the dental office the ideal place to get Botox?
Well, dentists know facial muscles. I mean, that's one thing that we studied a lot. So if you put Botox in a wrong area, you can get some results that aren't as optimum as you would like. So for one thing, we know facial muscles probably as well as anybody. The second thing would be, and I can't speak for other offices, but for my office, we work hard at creating a nice experience for the patient. So I've been to offices before, and they don't recognize. You feel like you're intruding in their day. You know, it's like, no, this is why our patients are here. We treat them like family, and they have a wonderful experience, and they tell their friends, and they come back. So for our office, Botox is a great place just because it's not a typical medical office.
Wonderful. And if people are a bit afraid or uncertain about Botox in the dentist's office, what can you say to alleviate some of those fears?
Well, I think the results speak for themselves, so I guess you could ask any of our patients who get Botox, but just in general, the needle for Botox is so microscopic almost that you really don't feel that. You don't.
Perfect. All right. Thank you so much, doctor. Appreciate it.
Good. Good to be here.
Pousson Family Dentistry is offering a new patient special. Receive an exam plus a full mouth of x-rays for $95. It's normally $275, so act fast. Again, this offer is for new patients only and does not apply with insurance and cannot be combined with other offers. To learn more about Pousson Family Dentistry, head to PoussonFamilyDentistry.com. Give them a call at 985-643-2828 or visit them in person at 640 Brown Switch Road in Slidell.